One of the most common pain points I see in dogs is actually the carpal joint or wrist. If you have a laser and you're treating a dog that has carpal pain or inflammation, I can help you out. I'm Dr. Lori McCauley from Optimum Pet Vitality, and in this episode of Learn and Go with Dr. Lori, we're going to be talking about how to laser the wrist to get much better results. I'm going to teach you one of my very favorite tips. So think about this. Here's our shoulder, elbow, and wrist. Our wrist sits like this. Now, if we go to laser that wrist and the dog is weight bearing on it, what happens? The laser actually has to penetrate through the bone to try to get to the cartilage. And the joint capsule is kind of compressed. But as easy as taking weight off of the limb and then bending it, can you see what happens? What we actually see is that joint opening up so we can laser directly in and affect that cartilage. We can have most of the effect here, but we can even get into these smaller joints down below. The other thing that happens when we flex or open up that joint is that we stretch the joint capsule so we can have the most effect right on the joint capsule. And that helps get rid of pain and inflammation and allows that joint to heal better. So how do we do this in a live dog? Here's Ollie. He's almost 14, and he actually does have wrist issues. You can see that by me flexing his wrist. It doesn't bend all the way. There's space in here. So when I laser him, I'm going to give you an example with a SpectraVet probe. Now, obviously, he would have his eyes covered or glasses on if it was connected, but it's not. With this probe, I would come. You can see where the wrist is. From here's the first joint line, and then the second, and then the third. So we would come in here and laser the third joint line by making sure that my probes are lined up with that joint line, and then treat the side. I would treat this side. You're putting your nose in the way, boo-boo. Make sure it's bent and treat the front. With his size dog, I can do that in 2 spots. I would treat above the joint. And then on the back, it might be easier to show you on this side. See where he has his carpal pad? Well, the accessory carpal joints are around there. So we would come in here and treat on one side of that, and then coming in and treating the other side. Okay, I hope you had fun. I hope you learned something. I'm Dr. Lori with Optimum Pet Vitality, and I'll see you next time.